Students, go down and meet your medical elders.
What's your step? Jesus. That long one.
The next batch.
Hello.
Please watch your step. Be careful so you hit the wire, please. Careful.
Ayoko Daniel.
When you want to pass, watch the ground, please, so you don't hit the wire.
Awute John Paul.
Alpha,
Ayade
please. Careful.
Emmanuel.
Oh? Abi. Jesus. Oh, I don't have. Careful, please. No, it work. It work. It work. Jesus. Oh, Jesus. He ain't good. He ain't good. He ain't good. Oh,
Chimeze Prosper Jugudi. Batnomi, Basi Ima Ede, Bennett Precious, Callistus Joy, Chelozi Favor, Chijoke Chisom, Chime Daniel, Chize Choma, Chukwu Toki, Lucy, Chukwu Lucy. What? Chukwu Ogolusi. your medical elders and check them. The next group, Mercy Ekperamaka, Chibuike Aja, Collins Enole, Paul Ezima, So Akaniyene. Done your death and faithful forgiving. You may go and handshake your medical elders. Next group, Raphael Anthony, Victor Oketima, God Power Iwasa, Destiny Okiemu Best, Efaiwa Emmanuel, Vanessa Chigom, Ekodipo Etubide, Tom Tochukwu Zena, Victoria Sika, David Etalo, Treasure Eto, Chika Dibia Godwin, Lucy Izuchukwu, Bright Isioma, Victor Akachukwu, Ifeanyi Kingsley, Christine Nkioso Sowo, Chizom Miracle. You can now go and handshake your elders.
Watch your step. Watch your step.
Miracle Peter, Abdul Samuel, Olekon, Henry Mick Samuel, Abati Frege Sunday, Aroka Benson, Odiano Sam Emmanuel, Chizon Precious, Victor Sunday, Mary Magdalene, Ibufe, Samuel Ben Imo, Queen Uchechukwu, Agatha Biamite, you've done your check. Let's go and check your elders. Samuel Ben Imo, Queen Uchechukwu, Agatha Yongete, Mary Magdalene, Beth Udemita, Iyere, Favor Eson, Choma Festus, Daniela Joseph, Liv Vincent Christiana, Mabu Christabel, Benjamin Mana, Bethel Matthew, Dixon Mbagu, Wilson Mbagu, Console Mbajaku, David Ikechukwu, Jehoshaphat Nelson, Go and handshake your medical elder. Go and have a handshake with your medical elders. Move. Chibere Jude Naji, Ebanga Nsan, John Nte, Chukwuemeka John Paul, Ifechukwu Pete, Roy Chika Dibia, Favor Chiedika, Benedict Njore, Chinonso Rema, Prudence Bufa, Favor David, Christopher Ochi, Stella Grace Achibo, Steph Dory Ogonye, Abigail Ikpemote. Go and give a handshake to your medical elders. Go down and give a handshake to your medical elders. Oluwatife Esther, Kingsley Chukwuebuka, Daniel Uchechukwu, Precious Ebenyi, Tomadila David, Christian Chukwu Ebuikem, Princewell Uchenna, Augusta Kenechukwu, Faith Okoko, Triumph Imebo. Go down and have a handshake with your medical elders. Dangote Manoro, Esther Chidima, Daisy Chukwunonso, Nephet Emmanuel, Gospel Otosi, Precious Otosi, Chukwu Dumebi, Onwezem, Kalista Ogechi, Tamuno Pepo, Raquel Timothy, Emmanuel David, Emmanuel Ekewa, Grace Mesomachuku, Mary Steve Oga, Idonweze Tiene. down and have a handshake with your medical elders. Brother, Rolly, Jude, Tekula, Lily, Tobias, Blossom, Ubi, Gertrude, Ubi, Kesta, Udeaga, Moses, Udeze, Gregory, Ogian, Aloysia, Uma, Kelvin, Uma, Blessing, Unaese, Joseph, Bishewa, Okwewi, Ibiam, Noble, Uchoma, Grace, Kenechi, Kingsley, Agbo, Goodness, Aniete, Confidence, Odagwe, Okoro, Adu, Vincent, Agada, Agada. Kneel down and have a handshake with your medical elder. Kekere Aniekan, Ubong Abasiudwa, John Egum, Michael Ina, Joel. Go down and have a handshake with your medical elders. We have come to the end of this word code class. Thank you. Come down and have a handshake with your medical elder. Thank you.
Yes.
Congratulations. White coat medical and dental student, clinical and dental students. Congrats. At least we have learned. You know how to dress in your white coat. Can we put our hands together for ourselves? At this point, we are going to the next item. May I invite Dr. Olga from the Faculty of Dentistry to handle this item as we put our hands together for him.
Will all the students stand up? You will read after me. And when you say I, you call your name before we continue. Are you ready? I, a fourth-year clinical or medical dental student, do solemnly pledge that I accept and acknowledge the privileges given to me this day as a medical and dental practitioner in training, and promise not to abuse them while providing care and service to patients. I will maintain the highest standard of professional conduct and approach all aspects of my training with honesty and integrity, embracing opportunities to learn from my teachers, patients, and peers. The health and well-being of patients will be my first consideration, and I will not use my medical knowledge to violate any human rights, even under threat or duress. I will give utmost respect for human life and the dignity of patients, and I will attend to them with humility and compassion, without bias or prejudice. I will not hesitate to ask for assistance or advice from my colleagues and teachers in the interest of the patient. I will respect the values, rights, autonomy, and dignity of all patients, and I will do them no harm. I will respect the diversity of patients' experiences, diseases or disabilities, religion, sex, culture, and beliefs. And I will always remember that warmth and empathy are integral parts of patient care. I will respect the secrets that are confided in me, even after the patient has died. I will at all times give to my teachers and colleagues the utmost respect and gratitude that are their due, and honor my responsibility to promote the next generation of physicians. I will attend to my own well-being, physical, mental, and social health, and abilities in order to provide care and support of the highest standard. I will accept my strengths and weaknesses and strive to develop those qualities that will earn the respect of my patients, my colleagues, that society places upon the noble profession of medicine and dentistry. I make these promises solemnly, freely, and upon my honor. So help me God. Thank you. You can sit down.
Thank you so much for that pledge. Can we put our hands together for ourselves, please? And may I now invite the Dean, Faculty of Clinical Sciences, Professor Atana Ewa, to give us an overview of clinical medicine. Can we put our hands together for her?
Thank you very much. The Vice Chancellor, Professor Florence Obi, ably represented by the DVC, Akada, Professor Nta, permit me to step into already established protocols. Thank you. These students are favored. I told them last week, they gathered in the classroom to receive orientation into clinical posting. And I remember on the first day, there was a lot of anxiety. I remember telling a lot of them, unfold your arms, your 210 stop. But I'm so happy to see that today they are very relaxed. After one full week of detailed orientation by experts in the 13 departments of Faculty of Clinical Sciences and the 5 departments of Faculty of Basic Clinical Sciences. The dentistry students have been handed over to Faculty of Clinical Sciences and Basic Clinical Science for a period. So whatever applies to the medicine and surgery program applies to the dentistry program at this time. I really wish to congratulate you all. Like we said last week, what is happening now is we are ushering you into the clinical posting. This is the dispensation of 50th anniversary of University of Calabar. And we want to caption you the golden medical and dental clinical students. Congratulations. You have had first in so many things. Like I told you last week, the classroom that you used was an ultra-modern. It's an ultra-modern already out. After your orientation of last week, you're going to start your posting. Your posting has started today in M1 and S1. And with time, you go to the laboratory, clinical laboratory medicine. So may we remind ourselves that the College of Medical Science, University of Calabar, started in 1978. And a year later, the BSc programs in anatomy, physiology, and biochemistry were commenced. And going down the history lane, the collegiate system in the medical school came to being in the year 2000, when the present Faculty of Clinical Sciences was created. The name has changed several times. Dentistry became a faculty in 2016, and then our baby, Faculty of Basic Clinical Sciences, was established in 2021. All these are modalities by the Medical and Dental Council of Nigeria to restructure the colleges and improve the quality of what we deliver to you. I don't need to remind you that you've just come out of basic medical where you left 5 departments behind, and we hereby introduce you to clinical posting. We told you last week that clinical medicine is totally different. While you were working with cadavers and the chemicals in the lab and the physiological processes, this time you're onto real life experience with real life patients. People who have life, who have breath, who can see, who can feel, whom you're going to communicate with. So it is paramount that you present yourself very well to the people you communicate with. May I remind you that levels have changed. The way you talk, the way you dress, the way you behave is paramount. If your patients are not pleased with your appearance, they have a right to tell you they cannot talk to you. May I remind you that there is no place for pride, being snobbish in clinical medicine. If clinical posting has not humbled you, then you're not going to get it right. Interpersonal communication and counseling skills is paramount. If you don't have it, you must acquire it. Humble yourself, talk to your patients, obtain the information that they have to offer. And then you now galvanize the information with a target at heading to a diagnosis. Without that, your purpose of history taking is not going to be successful. Now, a clinical posting is usually a hospital or clinic where you will go and have real life, hands-on experience with live patients and live case scenarios under supervision. Remember that you're not alone. Remember that we are watching out for you. We are watching for your attendance. We are watching for your dressing. We are going to watch even your own etiquette. Remember what we said, self-care is very important. We don't want medical students, student doctors collapsing during ward rounds or clinical posting. What did I say during orientation? Sleep well, wake up early, choose 5:30 or 6, take your bath, eat breakfast. I emphasize, eat breakfast before you come out. I belong to the set of Unica medical students who had buffet breakfast by 6 o'clock. Buffet breakfast. So what? You don't need that high IQ that brought you with the high jam scores. You need just above average intelligence, a listening ear, and patience. If you know you're tired, don't go to talk to any patient. If you're hungry, don't talk to any patient. If you're rushing to catch a bus, don't talk to a patient. If you're looking at a classroom lecture that you meet in 5 minutes, don't talk to patients. Only when you yourself are ready to talk. And the worst thing you do is be looking at your time while you are addressing history taking. Your major activities are going to be history taking, conducting good physical examinations using basic clinical skills, understanding the diagnosis of various medical conditions, and the treatment. Everything is done under supervision. Your take-home or key points are dress code. A lot of you have flaunted the dress code. We could have withheld adorning you with white coats. We announced to you the dress code of the faculty. The girls wear dresses or skirts and blouse, and the boys wear shirts with tie and belted trousers. And we emphasize that you don't go to slim the ward coat. For no reason, the ward coat has been given its own minimum sizing. So we are watching you. It must be knee, below knee. Some of you brought in those that were above knee. Some of you brought in those that didn't have unical badge. We are watching you. Nose rings. Oh, thank you, sir. Please, there's no room for extra rings on your body. Nose rings, extra earrings, colored hair. Hello? Colored hair. We don't take the color there. We can take black and brown. No red, no blue, no green. And we don't take the long hair. All the 30 inches, 18 inches, 16 inches are not going to be allowed. Tie your hair into a bun. You're not coming to pack all the viruses in the world to go back home. Please guide it. And that paper in your hand, you're going to sign it. The pledge is very important. Sign it and give to the college secretary, because you write your name on top and you sign it for submission. Health and well-being for emphasis. Hospital policies you must respect. Ethical issues. So I can announce to you the existence of the Student Support Committee. We are serious. Anytime you feel overwhelmed, please reach out and we'll talk to you. Teamwork. Discuss with your peers. I told you to form discussion groups. Please, it's very important. Thank you very much. At the end of all this hard work, I promise you, joy is coming. So sit up, rest up, prepare yourself. And remember, after God, now you. Don't play with that. After God, now you. So behave yourself. Get the confidence of your patients and prepare yourself as a student doctor that one day you will graduate and become a physician. Congratulations and welcome to clinical medicine.
Thank you so much. Please give a resounding applause. You heard it all. May I now invite the next speaker? Overview of laboratory medicine and clinical pharmacology training by Dean, Federal Basic, Faculty of Basic Sciences, Professor Godwin Ebue. Please, sir, you have 3 minutes. Can we put our hands together for him? 3 minutes, sir.
Sir. The Vice Chancellor, ably represented by the DVC, Professor Grace